Thank you, Elaine, and thanks to the NCCOR team for putting this workshop together. The organization is impressive, and this is a wonderful space to spend the day talking about an important topic around healthy eating and low-income consumers and shoppers. The Economic Research Service is very pleased to be a co-sponsor of the workshop along with NCCOR. ERS and USDA benefit from our membership in the consortium, which facilitates collaboration with other federal agencies and the Robert Woods Johnson Foundation with the goal to develop research on nutrition and obesity prevention. This workshop today provides an excellent example of how NCCOR enables the partners to identify the current state of knowledge as well as gaps that need new research. And I'd like to again thank you for coordinating the conference, which is the second in a three-part series on this general topic of behaviors and diet quality and nutrition decisions. Interestingly, this coordinated effort came about during a meeting of the NCCOR steering committees. The members were going around the table and realized that each of the partnering agencies were working independently on issues related to incentivizing healthier food purchases. So from that discussion, they decided that it would be good to join forces, hold a series of workshops where they could bring together partners and stakeholders to tackle this topic in common. The first meeting in this series was held in May, and it focused on projects that were using monetary incentives for healthy eating behavior. And a couple examples are USDA's Healthy Incentive Pilot Program, as well as several farmers market programs like Double Up Bucks, that increase healthy food purchases by making foods better nutrition quality foods less expensive. This meeting is the second in the series, and it focuses on behavioral economics and how researchers can apply its theories to test strategies for improving low-income and SNAP participants' food shopping choices. There's going to be a third workshop in September that will summarize what is needed by practitioners in the field in terms of future research and evaluation. So information from this workshop will feed into that discussion. And at that workshop, one of the goals will be to identify next steps for healthy food incentives. Laurel Kettle-Chan at CDC is organizing that workshop and would be happy to talk to people about it. Laura, if you're in the room, could you raise your hand or stand up? So, hi Laura, so please see Laura at lunch or during one of the breaks if you want to talk about the third workshop. I'll now turn briefly to today's topic and then not say a lot because we have a very rich set of panels and speakers today who are going to go into depth on the issue. But at USDA and other parts of the federal government and academic research community, there's been work to develop science-based guidelines to promote healthful food choices and the science basis for information policies such as nutrition labeling. However, despite all this, our data show us that Americans continue to make food choices that don't match the recommendations. For low-income Americans, the problem is especially acute because failure to make these food choices that are economical as well as healthy can compromise food security. So what to do? Well, behavioral economics theory is something that's relatively new in economics and has recently caught a lot of public interest. In contrast with traditional economic theory, it assumes that decisions are not made in a purely rational manner. So economists normally think that consumers are trying to maximize something we call utility, or companies are maximizing profit, and that guides all their decisions. In contrast, behavioral economics allows consumers or firms or companies to be somewhat irrational and to have behavioral factors influence their decisions in ways that are not accounted for in the standard economic models. For example, choices can depend on whether it's something that's in the immediate or distant future, or whether it's the default choice, or if the individual has to take action to make that choice. So that's a really short overview of behavioral economics, and we'll go into a lot more detail today. But at USDA, we found that behavioral economics provides insights into food purchase behaviors that suggest policy responses that can be successful. So far, we have focused on looking at low-cost ways to promote healthier food choices within schools and school cafeterias. Today's workshop tries to provide a basis for broadening that research and looking at how we can use behavioral economics levers in promoting healthy food choices in other settings, such as grocery stores. And given the scope of USDA's SNAP program and the public interest in increasing access to healthier retail options in low-income neighborhoods, I think it's obvious that this research has a lot of potential to influence policy and allow consumers to make better decisions. I think we've got, as Elaine mentioned, just a wonderful group of people here today to meet these objectives. We have policy stakeholders, representatives of the food retail sector, research leaders, and the presentations will help us identify feasible and potentially effective behavioral economic strategies that promote healthy food purchasing by SNAP and other low-income shoppers. I look forward to the discussions that will explore how these concepts can work, what kind of research we need, how they bring together the retail environment and consumer choices, especially for low-income populations. I think it'll be a really exciting day. So that's my one responsibility, is to give a broad overview of the workshop. The second is to introduce our two speakers. I'll follow Elaine's guidance and not give a detailed biography, but I do want to say a couple things about two of the USDA's leaders. Since 2009, Undersecretary Kevin Concanon has led USDA's Food, Nutrition, and Consumer Services. These programs administer the 15 domestic food and nutrition programs that collectively serve 1 in 4 Americans, providing children and low-income adults with food or the means to purchase food. And we've had at ERS a long-term partnership with FNCS and the Food and Nutrition Service in helping shape our research so it meets the needs to develop their policies and programs. And we're happy to continue that partnership in this workshop today. I'm going to make all my introductions at once and then let you guys just go through. Since 2010, Dr. Catherine Wotecki has served as the Undersecretary for Research, Education, and Economics Missionary at USDA, as well as the department's Chief Science. And her own personal research interests dovetail with this workshop in nutrition, food safety, policy, risk assessment, and I know from working for Undersecretary Wotecki, a keen interest in providing an evidence base for policy. And I think today's workshop is very much in that spirit. So without any further comments, I want to thank everyone for being here. We really look forward to what you have to say, and I can assure you we will use all this information in shaping our research programs and efforts to further support healthy eating choices by Americans. Okay.
Well, good morning. I'm Kevin Concanon. Very pleased to be here today. I see a number of familiar faces and folks that I don't know so well, but pleased to be invited with our colleagues from ERS. As Mary mentioned, we have a long-standing partnership, precedes certainly my time at the agency, but one that I really value. And Kathy Wotecki, every several weeks at sub-cabinet meetings, comes forward with sort of a preview list of reports that will be forthcoming. And I look forward to that, sort of like previews of very important research that ERS carries out and that so often really impacts and reflects upon work that is being done in the space that we occupy at the Food, Nutrition, Consumer Services. I have some of my colleagues here today from the Food, Nutrition, Consumer Service. folks at the Center for Nutrition Policy and Promotion, as well as leadership from the Food and Nutrition Service. So I'm pleased to be here with them as well. Today's a very big day for us, not only here, this very important topic, but we have a meeting on the other side of town today focused on school meals and school nutrition. If you've been reading the papers, it's been a cause célèbre, justifiably so, in recent months, and we're looking forward to that as one of a series of meetings. But there's much work being accomplished in the schools across the country, I think very positive work, and we're very committed to staying the course in that regard. Now, to today's topic, exploring ways to incentivize healthy purchases in the SNAP program. First, a little bit of background. SNAP, the Supplemental Nutrition Assistance Program, now is serving just over 46 million Americans. That number is down by about 1 million persons in the last year, reflecting spotty improvements in the economy in different parts of the country. But the long-term forecast for it is a very gradual reduction, not a rapid reduction, again reflecting the circumstances of people. I was up in the Northeast last week and the week before, in Rhode Island and up in central Maine. Both of those areas that I visited have been and continue to be deeply affected by basic changes in the economy and limited opportunities for people to live there. Well, the SNAP program is very responsive to what goes on in the American economy. And these days, just over 46 million persons, nearly half of whom are children age 18 or younger. So SNAP participants' diets, by the way, the focus today, are similar to those of other low-income Americans, and not so different from all Americans. The Center for Nutrition Policy and Promotion has devised a way of measuring how attentive and how adherent we are to the recommendations of the dietary guidelines. And if we're fully adherent to that consistently, we'd get a score of 100. Well, Americans combined get a score of 58. And people in the income ranges of SNAP recipients get a score of 51. And folks on SNAP, the most recent score attached to them, get a score of 49. So it's marginally, but just marginally less than the Americans at large, who have many more resources and have more time, more access to supermarkets, a variety of other factors. SNAP participants, the consequences, though, of obesity, I want to point out, I think and diet-related diseases can be greater in low-income communities and individuals, and thus we are committed to do all we can to prevent obesity in the SNAP population. Using SNAP as a vehicle for nutrition messaging and positive behavior change has potential for significant public health impact nationwide. Again, as I mentioned, nearly half of the participants at any given time are young people age 18 or younger. We're very committed to improving the nutrition standards and have been making progress across the range of programs that the Food and Nutrition Service oversees. Most notable among those changes, the Special Nutrition Program for Women, Infants, and Children, the WIC program. We made changes in the food package and the diet requirements now going on 3 years, close to 3 years now, and we're seeing very positive results as a result of that. 51% of the infants in the U.S. participate in the WIC program in the first year of life, and in states like California, 60% of the infants in that state are involved in WIC in that first year of life. So it's a nutrition program, it's a prescriptive preventive health program. It's one that's very important to us. Unfortunately, the potato lobby has been trying to inject themselves into the WIC program. The last thing we need, I think, is more white potatoes in WIC. But on the whole, we've been pushing back on a science-based, reminding Congress that this is a science-based nutrition program. And we very much appreciate the support we've had from a whole range of health organizations, health entities, professional dietitian and nutritionist organizations supporting holding on to the integrity of the WIC program. The National School Breakfast and School Lunch programs similarly are in the midst of major improvements. Now, we just completed the second year of new meal requirements in the National School Lunch program and in the School Breakfast program. Those changes in breakfast are more modest, but now in both of those programs, daily fruits and vegetables are part of the program. And the dairy is healthier, there's less fat, there's less sugar. We've really made where we have goals for lowering the sodium levels, both of those program areas as well. And the reach of those programs, the National School Lunch Program serves in excess of 30 million children each day, 21 million of whom are free or reduced price based on family income. So these are very much children, students who are at risk, and they get a major portion of their nutrition through those school meals programs. Well, starting this month, starting in July of this year, the reach of those programs has been considerably broadened because about 99% of all American public schools participate in the National School Lunch Program. Half of the private and parochial schools participate in the National School Lunch Program. And any of those schools that participate in that program are now bound by new federal standards for all of the food sold in those schools during the school day. What we call formally the smart snacks rule or the competitive foods rule basically says if you are a student in any of these schools, 99% of the public, half of the private, starting this academic year, the foods that are sold in an a la carte line or in a school store, I've seen them in larger high schools across the country, or in vending machines, must meet dietary standards for the first time. So the impact now has moved from the 30+ million children who consume a meal through the National School Lunch Program to the 52 million children that go to an American school each day. So the reach is huge, and that's why our commitment is so firm in staying the course, and we're greatly aided by the passion and the resources of the First Lady to stay the course on improving the diet and the food environment for all American school children. Now, in the case of SNAP, we were benefited by the Farm Bill that was just passed, surprisingly so, in my view, because we had to really worry about where we were at this time last year with the House of Representatives bill. And what actually came out of the Senate was far more modest in terms of cuts and actually had a couple of major areas of opportunity in terms of intending to improve access to healthier foods for SNAP households. SNAP, as you know, is structured differently from the WIC program. WIC is a prescriptive program purposely designed to address the foods that low-income moms and very young children don't consume sufficient amounts of. SNAP is very different in that regard. SNAP is one can purchase any foods in SNAP as long as it's not a hot food. And you can't purchase, obviously, alcohol or tobacco. But in terms of foods, you have access to the whole range of foods. Well, one of our current major initiatives in that regard is to promote, again, SNAP education or stronger focus on nutrition education. We actually have one of the largest sources of nutrition education in the U.S. It's almost $400 million a year that goes out to states, and based on changes in the Healthy Hunger Free Kids Act, those nutrition education funds now can be used as well for policy advocacy in various states. And we've been very focused on encouraging states, particularly states that are on the receiving end of large new amounts of new funds, to use some of those funds for policy advocacy, in addition to some of the research-based, evidence-based approaches for nutrition education. So we're strengthening that program. We've made some progress in that regard, but we have miles to travel still. We are promoting as well farmers markets. I'm pleased to say last week we hit a milestone in the country. We now have 5,000 farmers markets or direct farm service entities, direct farm marketing opportunities, where EBT cards or electronic benefit cards can be used for the SNAP program. And that's about a six-fold increase since 2008. I'm going up with the Secretary tomorrow to Baltimore to tour the farmers market. We're celebrating that fact, and we are excited about the fact that as we nudge people in the direction, when Mary was talking about behavioral health, we know we need to do a number of things to nudge SNAP households and SNAP recipients in the direction of healthier eating. The beauty of farmers markets, especially this time of year in this climate, this part of the country, they have fresh, locally grown foods that are less processed. As we indicated to an industry group that came to see us earlier this week, the average American is now consuming something like 500 more calories per day than just 20 or 25 years ago, and over time this adds up. And we can't expect that the school meals program alone is going to solve that problem of obesity in the country, but we certainly believe and strongly believe that redirecting people, nudging people back in the direction of less processed food can make a difference. We're also very interested in the retail environment. We have now 250,000 stores across the country that have the ability, legal ability, to process SNAP benefits. I don't think we frankly need 250,000, but that's what we have. And I'm very interested in strengthening the depth of stock food requirements for those stores. We made changes in the WIC program now almost 3 years ago in terms of stock requirements that WIC-only stores or WIC stores were required to provide, and there are about 45,000 stores across the country authorized for WIC. And we didn't lose any stores because of a strengthened requirement. We did get the pushback in certain quarters saying, well, these folks, quote unquote, won't buy this food, they won't buy this, they won't buy the whole grains or the healthier food. Guess what? They bought that. And we hear lots of anecdotal evidence that it has benefited those communities as well, other non-WIC households. So we're very interested in what our options are in SNAP, because it's a major source of revenue, obviously, to stores, $75 billion in benefits over the course of the year. What else could we say in terms of to stores? Okay, if you're going to process SNAP benefits, then what should the depth of stock, the minimum depth of stock, be in terms of healthy foods? I remain interested in an entity that is largely present out on the West Coast, referred to as in California in particular, but also in Arizona and down in Oklahoma as well, and Missouri, a couple of states, but mostly on the West Coast. WIC-only stores that are relatively small in terms of square footage, but only sell foods that are approved for the WIC program. And I've been very interested in seeing that model adopted in other states, particularly in zones or parts of cities that are food deserts, that basically just have bodegas or corner stores that don't have many healthy foods. And those stores in California are very viable, those WIC-only stores. They're profitable. But the difference is they sell basically just healthy foods. So we have one of those California owners that has just opened 2 stores in New York City just within the last year. So we're anxious to see how that goes, because I've certainly been interested in seeing whether we could explore that for Baltimore as an example. We've opened up some inquiry there. And I mentioned in the upper Midwest when I was up in Ohio here now some 6 or 7 weeks ago, to see whether that would be, again, a model. They're easier to stand up than a full supermarket. You don't need as much space. You don't need the same kind of volume to make it profitable. The key variable seems to be it needs to be close to a WIC clinic. So those moms that are going into the WIC clinic have ready access to and easy access to such stores. So we're very interested in that on that front alone. We're also, as was mentioned in Mary's overview, we are interested in the double up bucks programs in farmers markets. We work very closely around the country with a national group called Wholesome Wave. They're involved in hundreds of farmers markets around the U.S., but increasingly now we're seeing some of the health entities, Kaiser Permanente, ProMedica up in the upper Midwest, some other health systems that are also providing additional matching funds to either WIC households or SNAP or both when they go to farmers markets, as a way of nudging people in the direction of eating healthier foods. We have, based on our Healthy Incentive Pilot experience up in Massachusetts, we're testing now a project up in Minnesota, testing the impact of offering $5 coupons to SNAP households for the purchase of locally grown fruits and vegetables. In Michigan, in the Detroit area, we have a project underway making locally produced produce available in corner grocery stores in that metropolitan Detroit area. And down in the Southwest, we have a major supermarket chain that is, when you use a SNAP card and they notice that you're buying white bread instead of whole grain bread, or you're buying a lot of frozen foods and not much frozen pizzas now, not frozen vegetables, they produce with your receipt coupons for future visit that say here's $3 off produce, or here's $2 off a loaf of whole grain bread. And we're interested in seeing whether that induces people, again, over time to eat healthier in the SNAP program. We're very interested in talking, and we've spoken with several states about additional ways in which they might nudge folks in SNAP into healthier eating habits as well. But we don't see any single way in which to resolve this. We think part of it is access. Part of it is, again, educating people. Part of it, as we had a lengthy discussion earlier this week around the time that households have to prepare foods. Here's an interesting statistic. We have a higher percentage of people in the workforce on SNAP now than was historically the case over time. That's the good news and the bad news, in my view. The good news is that SNAP is there to supplement that income. The bad news is, even though people are working, 31% of these households in the workforce, at least one of the adults, they're not making enough money, or they're not getting enough hours to be able to support their family. So we're very interested in just seeing, okay, as our discussion earlier this week was, well, in those households that are working, how much time do they have to prepare a meal? Because the Institute of Medicine, sort of at a report more than a year ago, raised that question with us. What impact does that have in terms of the time that those parents have or the adults have to prepare food? And does it, unfortunately, nudge them back in the direction of buying foods that are prepared invariably overly processed, more sodium, many of the elements that we're trying to move people away from? So those are some of the challenges that we face on our side. We are encouraged by the way we've been able to deploy, with the help of many, many organizations and people across the country and states, new meal patterns in several of our major programs, and we look forward to availing ourselves of more of the findings in behavioral health. I know one of your panelists later today, or several of them, are going to be talking about that. We have a very strong relationship with the center up at Cornell that we rely upon for advice, for tactics, for strategies in the school lunchroom, the so-called smarter school lunchroom. And we're interested in taking some of those same behavioral health concepts and saying, what can we do with our SNAP population generally to further encourage them and nudge them in the direction of healthier eating. So more work to be done, encouraged by what we see out there, but no, we still have miles to travel. Thank you.
Great. Thank you. Good morning, everyone. It's a real pleasure to be with you this morning. I'd like to add my welcome to those you've received already this morning, and also to say thank you to our partners in NCCOR for all the help and assistance that you've provided in getting us to this point. We really appreciate it. I wanted to focus my opening comments for this workshop around this issue of the role of research in creating evidence-based policies. And we're going to be focusing on SNAP today, which is really a very important program for us. And in my role as Chief Scientist and Undersecretary at USDA, I have responsibility for a portfolio of 4 science and statistical agencies. And like the science agencies in other federal departments, we have a responsibility for furthering knowledge in the social sciences, the biological sciences, the physical sciences, as they relate to challenges facing agriculture, food, natural resources in the environment, and human nutrition. We also, though, have a second purpose, and that is to provide the evidence base to inform good policy and good program decisions. So I want to focus my comments on that second role today, because that's clearly what this workshop is going to be all about. As my colleague Kevin Concannon indicated in his opening remarks, SNAP is an enormously important part of America's national nutrition safety net. It's a huge program. It reaches a really diverse population. And again, from the research agency's perspective, when we think about SNAP, we're constantly asking ourselves, how can research help this really important program ensure that it's reaching the goals that are set for it? And that's where this evidence-based decision making comes in. It's a term that's being used more and more often here in Washington. And I'm also seeing it appear sometimes in the popular press, so obviously it's gaining some credence. There is a clear directive from the Office of Management and Budget that we need to be moving to incorporate more evidence-based approaches in the way that we design and implement and evaluate federal programs. And in my role as Chief Scientist, one of the projects that we have underway right now for the Department of Agriculture is to develop an inventory of what the evidence-based approaches are that we're using across the department. And we're just in the midst of doing the collection of these best practices that the different agencies within the department are using. And it's really quite a wide array of different approaches. So second, once we complete this inventory, very important thing that it will be used for is just informing other agencies about the kinds of approaches that exist and are being used that might be applicable within their programs. We very much rely on the Economic Research Service in the partnership that they have with the Food and Nutrition Service to be generating evidence that is useful to decision makers from the undersecretary all the way through the agency. And there are some new evidence, new data that are forthcoming, new research that we think are going to be very important and helpful and will be also discussed throughout this workshop. There are new modules in some of the surveillance system data, as well as the recently completed but not yet quite available National Household Food Acquisition and Purchase Study, or the FoodAPS study. We do know, though, that SNAP is achieving some of its goals, particularly as it relates to alleviating poverty. And Economic Research Service has shown that SNAP provides benefits to households in need. These data are from fiscal year 2012. And if you look at the sum of the columns in green in the left and the middle, they show the gross monthly income for SNAP households of 82% of the SNAP households was less than or equal to 100% of the federal poverty line. And the impact of when you add the SNAP benefits onto the household income, it shifts that distribution to the right, so that a higher proportion are above 100% of poverty. So by adding this dollar value of the benefits to the household's income, you can see that the overall welfare of the household is shifted to the right, and that there's an even greater impact on the poorest SNAP households, moving 14% above the 50% of the poverty guide. We also know that the effect of SNAP is very pronounced in reducing child poverty. And these data show for the decade of 2000 to 2009 that adding SNAP benefits to the family income reduces the poverty rate and leads to even greater reductions in both the depth and the severity of poverty among children. This anti-poverty effect of SNAP was especially strong in the final year, 2009, when the American Recovery and Reinvestment Act increased SNAP benefit levels. SNAP also helps to maintain food security. And again, the American Recovery and Reinvestment Act of 2009 increased benefit levels for SNAP participants and expanded SNAP eligibility for jobless adults without children. One goal of that program change was to improve food security of low-income households. And again, ERS research found that food expenditures by the low-income households increased by about 5.4%, and their food insecurity declined by about 2.2 percentage points from 2008 to 2009. And food security did not improve for households with incomes that were somewhat above the SNAP eligibility range, and those are the households that are shown in the 3 bars to the right. But from a human nutrition perspective, is the program meeting what we would like to see it meeting as a nutrition program? Does SNAP promote healthier food choices? And as my colleague Kevin Concannon has already shared with you, unfortunately, the answer is somewhat qualified no. On every component of the Healthy Eating Index, except for sodium intake, SNAP participants score significantly lower than higher income adults, and they score lower than income eligible non-participating adults on most of these components as well. And this is a big concern because poor dietary patterns and consumption of extra calories can lead to diet-related health problems, weight gain, and obesity, which in turn are risk factors for chronic diseases. And analysis from the National Health and Nutrition Examination Survey indicate that on the average, SNAP participants, which are shown in the first column here, have a significantly higher body mass index, They're more likely to be overweight, they're more likely to be obese, they're more likely to have a greater weight gain over the last year, and they're also more likely to report having had a stroke or heart disease or diabetes when they're compared to higher income adults. So clearly, we're looking for research-based insights that are going to help our colleagues in administering these programs to help the clients have better food choices that ultimately are going to provide for better health. The ERS and partnered with the Food and Nutrition Service have supported a national household food acquisition and purchase study, or the FoodAPS study, that has just been completed and is going to be adding a lot of valuable information on food acquisition of households, and it contains an oversample of SNAP households that's going to permit some in-depth analysis of these data. We also have from ERS some new web-based tools that are also going to be helpful to researchers, a Food Environment Atlas and the Food Access Research Atlas. The FoodAPS study will have in-depth information on food at home, as well as food away from home and food obtained from pantries and other assistance programs, as well as food that's consumed and from gifts from families and friends. So a big challenge for you for the rest of this workshop is can behavioral economic strategies suggest ways that are going to help make healthier food choices easier for SNAP shoppers. Behavioral economics, as we heard from Dr. Bowman, is a way that allows economists to look at predictable errors in judgment that can keep consumers from acting on what may be their good intentions. And it also suggests how the environment itself can be modified to help people avoid these errors. So changing the choice architecture, I believe, is the term that's used. ERS, with support from the Food and Nutrition Service, helped in establishing the Cornell Center for Behavioral Economics that has really been providing great insights for the school lunch programs. And today's workshop, we're hoping, is going to provide us with some additional insights that are also going to be helpful for the SNAP program in the future. We're also real pleased that again, this partnership between ERS and FNS, they're joining forces to launch a new center in behavioral economics and healthy food choice research. The objective of it will be to develop strategies that promote healthy food choices by SNAP and by WIC participants. And this workshop, with all of the great minds that are gathered here, I think is also going to be a real fertile area, not only of ideas that might be pursued under this center, but also through all of the research programs that you are involved in and that we within USDA are involved in as well. So I am very much looking forward to the results that will be forthcoming. I understand there will be a white paper that will be developed, and I will be very much looking forward to reading that. So thank you all for coming together this morning, sharing your good ideas, and I hope you find it as stimulating as I'm sure that we're hoping it will be.